Welcome to This Explainer. Today, we're diving into the fast-paced world of intravascular catheter-related infection prevention. We're going to follow the actual catheter life cycle, giving you the absolute fundamentals to keep your patients safe. Let's get straight to it. Look, we're starting right out of the gate with the high stakes. Healthcare-acquired infections, or HAIs, they're not just some annoying dashboard metrics. These are literal life-or-death issues that drain hospital resources, devastate families, and cause totally unnecessary deaths. What we're talking about today is literally your frontline defense.
All right, let's quickly identify our main targets here. Peripheral venous lines, the short ones in the arm or hand, rarely cause bloodstream infections. But those central venous catheters terminating right near the heart, those are the heavy hitters causing the vast majority of infections. And then you've got PICCs right in the middle, peripherally inserted, but thankfully with a much lower infection rate than standard CVCs.
Section 1. Preparation and insertion. Setting the sterile stage. You've got to treat insertion just like a surgery, guys. You are breaching the body's primary defense, so these 3 steps are absolutely non-negotiable. Step 1, rigorous hand hygiene. Step 2, maximal sterile barriers for CVCs and PICCs. I'm talking cap, mask, gown, sterile gloves, the whole shebang. And step 3, skin prep. Use greater than 0.5% chlorhexidine with alcohol and literally let it dry completely before you do anything else. Now, site selection is totally different depending on patient age. For adults, stick to the upper extremities. You really want to prefer the radial, brachial, or dorsalis pedis sites over femoral. But for pediatrics, you've got more options, including the scalp, but, and this is absolutely crucial, do not ever use the brachial site. Moving on to Section 2, maintenance and dressings. Daily defense. Once that line is in, vigilance is your best friend. Here are your daily must-dos. Perform hand hygiene before and after any touch, for sure. Wear gloves for every single dressing change. Wash those central lines daily with 2% chlorhexidine. And watch the clock on short-term CVCs. Replace gauze every 2 days and transparent dressings every 7. Oh, and obviously change them immediately if they get damp or loose. Just as importantly, let's talk about the strict don'ts, because these are the mistakes that breed resistance. Do not submerge the site in water. No way. Don't routinely use systemic antimicrobials just trying to prevent colonization. And never use topical antibiotic ointments on insertion sites unless it's a dialysis catheter, because they basically just roll out the red carpet for fungal infections.
And we definitely can't forget the hardware timelines. Replace continuous administration sets every 96 hours. Got blood or fat emulsion tubing? 24 hours, max. Change your needleless connectors every 72 hours. And my personal favorite rule, always scrub the hub for at least 15 seconds before you access a port.
Section 3. When to remove. Knowing when it's time. The ultimate goal here is getting that hardware out, right? You pull a peripheral line immediately if you see signs of phlebitis, like warmth or tenderness. But we really need to debunk the outdated practice of routine replacement for CVCs or PICCs. Don't just remove them to prevent infection. And honestly, don't pull them based on a fever alone without using your real clinical judgment. Now, for our highly vulnerable neonatal patients, umbilical lines are on an incredibly strict ticking clock. Artery catheters come out at 5 days max. Venous catheters, 14 days max. If you see signs of infection, vascular insufficiency, or thrombosis, pull that line immediately. And a super important prep note here, avoid iodine tinctures entirely, as they can really mess with the neonatal thyroid. So, I want to leave you with this challenge for your next shift. Look at your patients and ask yourself, is that central line truly still necessary today? Because the absolute best way to prevent an infection is to not have a catheter at all. Advocate for your patients, pull those lines when they aren't needed, and keep everyone safe. Thanks for tuning in to This Explainer.